Hi, everyone, and welcome to the fourth session hosted by me of our community learning series. My name is Brendan Hoffe, and in today's session, it's going to be called Why Me, or the Susceptibility and Post-Concussion Syndrome. If this is your first time joining us, then welcome. Pleasure for you to come along in this series. This series is about deconstructing some of the science behind the topics associated with post-concussion syndrome. I'll explain every term as we go, so you don't really need a whole lot of a science background to follow along. You just need an interest in science to keep engaged. If you're here with us from earlier sessions, welcome back. And some ideas will start to feel familiar as we begin to keep building on them as we go through these series. So here's just a brief overview of what we're going to be talking about today. First, I'm going to explain what susceptibility actually means. Then we'll walk through the 5 kind of most likely, or top 5, I guess, if you will, areas of research that can show someone is more likely to have a longer recovery. Those include age, biological sex, whether you've had a concussion before, pre-existing mental health conditions, and lifestyle factors such as exercise, food, or alcohol. By the end, you'll have a bit of a better picture of why 2 people can have what looks like the same injury and end up on completely different recovery paths. So, let's begin with the word itself. The Oxford Dictionary defines susceptibility as being likely to be influenced, harmed, or affected by something. Some people call these things or these factors that make you vulnerable, sensitive, or predisposed are common terms. Now, in plain terms, think of this as your kind of personal risk dial. Susceptibility factors are the things that either turn up or turn down that dial. So they don't necessarily decide your fate, but they definitely shift your odds. So here's an important shift in thinking that we need to get from the start. The question we're answering today is not, will I get a concussion? But if I do get one, will my symptoms stick around longer than they should? And one more thing to keep in mind as we go through each factor is that none of these factors work alone. Age, sex, history, mental health, and lifestyle all interact with one another. So when we talk about them one at a time today, that's just to make things easier to explain, not because they operate in isolation alone in the real world. So let's begin with age. The general pattern is that an aging brain is more vulnerable to a slower recovery, and that's just naturally with the age of the brain as it goes through life. If you remember from the previous session I hosted, so when we talked about the energy game and the energy crisis, we talked a lot about the cell's energy producers, or the mitochondria. As we age, those mitochondria become less efficient at producing energy just naturally. That matters a lot after a concussion because, as we've talked about, recovery is basically an energy demanding repair job. And an aging brain simply has fewer resources on hand to do that repair compared to when it was younger. Researchers have also linked this kind of mitochondrial slowdown to memory problems, which also gives us a sense of how much these tiny factories affect everyday brain function, not just in concussion recovery, but as the brain ages. There's more to the aging story that we need to talk about as well. Older brains are also less able to build and repair the connections between brain cells, a process known as synaptogenesis. So as the brain ages, those tiny connections between neurons naturally degrade. If they're not used or not firing together, they tend to lie dormant or detach naturally. On top of that, aging brains tend to show more abnormalities when it comes to things like blood vessels or like weakening of the blood vessel linings. There's also a bit more background inflammation as you age and elevated everyday stress onto the body for various reasons. None of these are dramatic on their own per se, but stacked together, they mean an older brain is simply starting from a tougher position when it needs to recover from an injury. So, what does this look like in kind of real numbers? Research shows that adults over 50, or what they considered as elderly or older individuals, are roughly 11 times more likely to develop PCS after a fall and about 7 times more likely to develop PCS after a car crash. It's worth noting also that the number one cause of injury in older adults is falling. So that's why that number is so huge, the 11 times. It's because elderly individuals have the tendency to fall more, just basically due to strength, due to muscle composition, due to bone structure. It is the number one cause of injury when it comes to the elderly population. And so here's a key nuance that we need to keep in mind when we're talking about age. Age itself doesn't cause post-concussion syndrome. Age predicts post-concussion syndrome mainly because it changes the way that people get hurt in the first place, along with the biological changes in the brain that we just covered, right? It's less that getting older is dangerous itself. That's not what we're saying here. It's that the more that the combination of how these injuries happen and how the brain responds really shifts those odds into the likelihood of post-concussion syndrome being developed. So we're going to move on from age into the realm of biological sex. In sports, when the rules are identical for everyone, research consistently shows that females are concussed more often than males and tend to report a heavier overall injury burden. This can look like things such as more severe fatigue, lower alertness, and more daytime drowsiness. Now, females also show up in the emergency room for concussion-related injuries at higher rates compared to males. But if we look at the males, males are more likely to report memory loss or confusion right after an injury that extends into the post-concussion syndrome development timeline. So the symptoms don't just differ in how many there are, they also differ in what kind of symptom shows up. So a 2025 systematic review, or basically a article that kind of compiles all this research from around the field that they're talking about, dug a little deeper into what actually is happening to the brain itself when we're talking about biological sex. It found that females tend to show changes in what's known as the white matter. So if this is your first time hearing about this, it's the kind of cable area in your brain, or the insulation to those cables, the fatty insulation to those cables that are providing the communication between different regions of the brain. Males, on the other hand, tend to show a bigger drop in blood flow to the frontal cortex, which could help explain some of these confusion or the short-term memory problems, because that area of our brain is heavily involved in these kinds of things, such as and as well as like planning or decision making or keeping in tune with what's going on in the kind of executive functioning of your brain. It's important to say that these differences aren't perfectly consistent from study to study, and that's very common when it comes to human data, just because of how wide and variety of and diverse of different types of people there are. Another very important thing to mention is that research in female-specific areas is historically understudied. One area of research that is actively digging into this and trying to uncover true meaning behind things is the role of hormones, including how the menstrual cycle might affect recovery, and the fact that estrogen progesterone, and testosterone levels they all can drop after a brain injury. So whether boosting or protecting those hormone levels can help recovery, that question is still open and being actively researched. So now let's kind of dive into concussion history. If you've had one before, does this make the next one worse kind of topic? So the results, strangely or interestingly enough, I should say, give a very nuanced answer. Interestingly, the strongest predictor of how long post-concussion syndrome lasts isn't actually the number of past concussions, it's the total number of symptoms someone is experiencing when they are concussed, and then that extends into a longer period of time. How this injury happens also matters a great deal. So things like loss of consciousness, having memory problems around the event immediately after, or just having other injuries at the same time as the head injury play a massive role in the development of post-concussion syndrome. What we do know clearly is that having a concussion roughly doubles your odds of a future concussion occurring. Now, this can be a bit confusing, so let's just take a second to break this down. So, previous concussion history, the topic that we're covering here, plays an indirect role with post-concussion syndrome development. A history of concussions predicts the likelihood of getting another concussion, right? Because we just talked about how a previous concussion puts you at a roughly 2 times more likelihood of getting another concussion. And this leaves the brain vulnerable to symptoms in general, how we've talked about this before with energy demands or blood vessel or blood disruption and all those kinds of things. So people who experience multiple concussions are likely to get another, right? And that also increases the odds of experiencing a negative mechanism of injury. So what we just talked about, like loss of consciousness or having another injury at the same time as the one that you just, or having another injury at the same time as the time of concussion or hitting your head, which leads us to an increased likelihood of having a higher total number of symptoms experienced. So the previous concussion history plays a role in that indirect link between the development of post-concussion syndrome. Here's where concussion history really does show a strong direct link, and it's with mental health. A 2025 study of collegiate athletes found that repeated concussions were a strong predictor of mental health risks, especially mood disorders such as depression and anxiety, just to name 2. And that naturally leads us into our next topic. So, depression and anxiety, I'm sure, as we're all very aware, are not just feelings, right? They involve measurable changes in the brain and how the brain circuits are working. In depression, there's often disrupted activity in the frontal cortex, the planning and decision-making area we mentioned earlier, along with the mesolimbic area or the mesolimbic system that we've kind of talked about before. But this is a structure or pathway in the brain that's involved heavily with motivational behaviors and emotional regulation. In anxiety, there tends to be an overactivity in the area of the brain known as the amygdala, which, if this is your first time hearing about this, it's the emotional processing area in your brain, along with reduced activities in areas that normally help put the brakes on this particular region of the brain. Research also shows that somewhere between 12 and 44% of patients report depressive symptoms within the first 3 months after a concussion. Now, that's a wide range, admittedly, but even the low end tells you that this is a common occurrence. Across the research that we've reviewed, Pre-existing psychological conditions come up as the single most consistent factor or risk factor when discussing and when looking at post-concussion syndrome. People with a pre-existing psychological condition are about 5 times more likely to develop persistent symptoms. Now, an important note here, mental health symptoms after a concussion can absolutely show up in people with no prior history at all. So this isn't a situation about blaming anyone or saying that only certain people are at risk. What matters most here is how a person perceives their own recovery. Expecting the worst outcomes or assuming every new symptom must be caused by this injury has been shown to has been shown to be linked to a greater and more persistent symptom reporting. So, emergency room data that we can rely on backs up what we just covered. A 2024 study looking at emergency department assessed risk factors for post-concussion syndrome found that the strongest predictors were pre-existing psychiatric history, having an immediate headache following a traumatic brain injury, having other neurological symptoms, as well as being female, some of the stuff that we've covered so far, right? Overall, in this study, a pre-existing psychiatric history made someone 2 to 3 times more likely to develop post-concussion syndrome. Now, depression symptoms specifically can play a very strong role in a reinforcement loop as well. Worsening fatigue, a loss of interest or pleasure of things that you normally do or enjoy, so that's known as anhedonia, or low energy, which is lethargy, disrupted mood, and general brain fog can all deepen this symptom experience further and be a reinforcing loop for the development of post-concussion syndrome. The good news here is that there are effective strategies to limit this. So some of the research has pointed towards just being educated about what to realistically expect during recovery helps a lot. And we've talked about that when we look at kind of the planning and prioritizing aspects in previous webinars. So as well, on top of that, so does a realistic gradual return to activity instead of the all or nothing approach that some people kind of try to put themselves into. On top of that, counseling or cognitive behavioral therapy or CBT or CBT adjacent techniques has been linked and shown to be strong evidence for breaking this cycle and moving forward. Now that we've talked about the pre-existing psychological conditions, let's shift into the lifestyle factors, and we're going to start with exercise. So here's something that we've talked about quite a bit when it comes to the recovery process and all that kind of stuff, but it still surprises people from time to time, is that complete rest is not the best approach. Older guidance that we used to use, say like 15, 20 years ago, saying that resting until every symptom is completely gone is not correct. We now know that prolonged rest, so day after day of not doing anything, can actually prolong the symptoms rather than just fix them. That's because your body becomes physically deconditioned to activity. So blood flow through the body body and brain becomes worse or inefficient over time if it's deconditioned. The nervous system becomes less conditioned to feelings or movement or kind of sensations, or just basically less used to things, really. And the system that regulates blood flow to the brain, the cerebral auto-regulation functions, doesn't work as well if there's not really that much exercise put into play. The current approach instead is a controlled, gradual increase in exercise kept below the point where symptoms are triggered. Remember those graphs from previous ones where the line goes just below or dips into the kind of mild symptom territory? That's where you want to be when it comes to managing exercise and concussion recovery, and especially post-concussion syndrome. This approach can also help diagnose and treat lingering post-concussion syndrome symptoms, not just to prevent them. So, some early research done in animals rather than humans thus far, and we're going to talk about that in a minute, suggests that being physically fit before an injury might actually be protective. In that research, better fitness was linked to less damage to brain cells and their connections, as well as less oxidative damage, so kind of toxic chemicals that are released by your cells that harm themselves, which can also be kind of looked at the cellular wear and tear, and fewer chemical changes in the brain occur in the brain after an injury. Now, it's worth being honest here and upfront about this, is that this hasn't been proven in humans yet, at least not from what I was able to find with research. And that's partly because it's genuinely a hard thing to study when it comes to these kinds of parameters. You have to think about it like this. You can't ethically assign people to either exercise or no exercise, as well as get a concussion or not. So you can't assign people to get a concussion to test it, really. But the preclinical research, where we look at animal models to kind of look at how the body and similar nervous systems or similar bodily systems respond, are pointing to a promising direction. Now, if you were with us for Ashley Armstrong's special topics webinar about 2 weeks ago, I believe, I'm not really going to go into full depth here because she does an amazing job of breaking this whole nutrition aspect down. But nutrition was a pretty common lifestyle factor, so it's worth mentioning for the sake of today's webinar. Even without an injury, an unhealthy gut can worsen neurocognitive abilities through such things as increased inflammation, something that's known as the leaky gut, or where the gut lining becomes more permeable. So more things, pathogens, bacteria, or unwanted bacteria, that kind of stuff, are able to get into the bloodstream when they really shouldn't be. So with an injury, an imbalance in gut bacteria known as dysbiosis can actually develop within hours and worsen the overall injury burden by heightening that inflammation in the brain or increasing oxidative stress. So what we talked about kind of just a few slides ago about the toxic chemicals that are released by a cell that's stressed out. As well as disrupting the energy production that we talked about so much when it comes to the mitochondria and the energy demands of cells not being met because they're not being supplied by proper nutrition. Now, let's talk about alcohol. Considering the weather outside, it's summer, there's a lot of social outings, you might be more inclined to consume alcohol because of like social settings, that kind of stuff. It's important. This is an important topic to briefly cover. Now, normally, in excess amounts, alcohol disrupts communication between brain cells or brain regions by altering the activity of two chemical messengers primarily. The first one is the primary excitatory neurotransmitter known as glutamate that we talked about a while ago. And the other is the primary inhibitory neurotransmitter known as GABA. And that these two chemical messengers are constantly being used by neurons to communicate with one another across the brain. So if we look to the preclinical data or the animal models of what's going on, Chronic alcohol use over 10 days in this particular study delayed neurological recovery and increased anxiety like behaviors following a traumatic brain injury to these animals. Now, if we look at emergency room data after a concussion, it tells a slightly different story, but there's context and nuance here. So, acute alcohol use, often used for pain relief, and this is also, I should mention, not just alcohol, it's also with cannabis and smoking cigarettes. So, acute use of this or these substances, often to deal with pain relief or temporary relief of something, did not significantly influence the physical recovery of post-concussion syndrome in that data set. Though the researchers are still unsure as to why the preclinical data and the clinical data don't necessarily have the exact same mechanism. They're still confused about that, which is typical for science. So the clearest concern based on preclinical data that we can look at is repeated ongoing use is where the danger lies, not necessarily a single drink after an injury. Now, one of the things that the authors stressed, and we're also going to stress as well, is that this is a very important topic to discuss with your medical provider when it comes to, in regards to usage. So the idea that I can have, like, we saw in the webinar that you can have a drink after you get a concussion. That's not what we're saying. It's very important to be mindful of what is going on in your body and understanding your limits and kind of, again, working in that threshold of symptom flaring and not symptom flaring. It's going to work for some, but not for others. But the main takeaway point for this is that it's the chronic use of substances that kind of puts you into this danger zone. But that's also happens naturally without post-concussion syndrome. You might just be more prone to symptom development because of the vulnerability with PCS. Now, it's worth pausing here for a second and kind of discussing about why lifestyle factors are hard to pin down. Simply put, you can't predict in advance who's going to get a concussion in the general population. So pre-injury habits like someone's usual diet, their exercise routine, or drinking habits are almost never collected ahead of time because it's simply, like, if you think about it, unrealistic for everyone to keep a journal of that stuff or when the potential of getting a concussion happens. I can't remember what I had for breakfast on Monday, but that could influence what is happening on Saturday. Or my exercise routine fluctuates so much. So the kind of influence that plays when it comes to post-concussion syndrome for the development of post-concussion syndrome in the general population, that's why it's very hard to kind of nail these things down. But in the preclinical data, what we have from animals kind of shows, puts a bit of a better picture into what's going on. But an important thing is that the science doesn't translate always one to one. Another thing is that the populations that do collect this data, so take athletes, for example, where they're constantly monitored for what they eat for performance reasons. They're constantly working out with very guided and specific workout routines. Their sleep patterns are analyzed. Their mood and behavior are very documented. Like where we get that pre-concussion history information isn't always representative of everybody else because athletes are not like everybody else. So even though there are early laboratory data on lifestyle factors and those point to being strong influences of what's going on, lifestyle when it comes to humans and our behaviors remains the least conclusive out of these top 5 domains that we're covering today, simply because it's the hardest one to study really when it comes to real people. There's so much diversity in what everybody does. And the proper questions or proper statistical modeling of those kinds have not been developed or still need to be tested and verified for their reliability when it comes to looking at these kinds of factors. So let's bring everything together at the end here, okay? Not one single factor determines whether someone is going to get post-concussion syndrome. I'm sure we're all aware. All the factors that we've kind of talked about today interact with one another in some way so they interact with all each other. Though some carry, as we've seen before, or as we've seen from the topic here, some carry more weight than others. A common thread that we can kind of pull between all of these several factors is the mechanism of injury, meaning how you got hurt. Like, so whether you had loss of consciousness or there was another injury at the time of hitting your head, and how many symptoms you're experiencing are the strongest predictors, as well as the pre-existing psychiatric conditions and the total symptom count. Those two consistently came out as the strongest predictors of a longer recovery when it comes to post-concussion syndrome. So the main takeaway is this: prevention and recovery plans should be personalized for the reasons that we've talked about in today's webinar. There's no one-size-fits-all recovery timeline because there's no one-size-fits-all brain or lifestyle. Everyone's different. Everyone has their own way of doing things. So this brings us to the end of today's webinar on susceptibility and post-concussion syndrome. I know it doesn't necessarily provide all the answers or kind of like a what I can do take home kind of practical thing, but hopefully today's topic and lesson really sheds light on why some people are more likely to develop post-concussion syndrome than others. It's also worth mentioning that these are just the top 5 factors. There's a whole host of other factors that play an important role when it comes to this. But for the sake of today's webinar and the 30-ish minutes that we have, and keeping things simple, that's for sure, these are the easiest to explain. So, for example, genetics plays a pretty big role, but in order to distill genetics into just a portion of one of these like subtopics, you'd be doing it injustice in explaining its role. So with that, thank you so much for everyone to joining us today. On your screen, you're going to find some helpful information such as our helpline, where we can connect you free of charge with resources to help you find providers or experts who can help you on your concussion recovery journey. I also want to mention our Instagram, where we'll be posting these kind of shorter explainer videos soon. So follow along to stay up to date with that. And for more information about just general stuff, you can visit the concussionfoundation.ca website, our website. And thank you so much for tuning in and being a part of this webinar series.